This is Dr. Ajay. Last time I spoke to you about HIV symptoms, the staging, and how to identify a patient with HIV based on symptoms. So today in this video I will be discussing more about how to diagnose a patient with HIV, what are the tests available, what are the treatment options available, and how to prevent HIV. So when we come across a patient with HIV, the only way we can diagnose a patient with HIV is by doing blood tests. There are different kinds of blood tests available. They can be from tests that detect the antibodies for HIV. There are tests to detect the antigens on HIV like P24. Then there are tests to detect the virus itself like PCR. So when a patient is exposed to a HIV positive patient either sexually or through injections, then the patient develops in antibodies in his body. So these antibodies will take at least 3 to 6 months time to develop. So in this duration, which is called as window period, in this period we won't be able to detect the antibodies. So all the tests like ELISA, TRIDOT, Western blot, these tests won't be able to pick up the patient in the window period when the antibodies are not there. So if you want to detect the antibodies, you need to wait for 3 months or 3 to 6 months after exposure. So if you cannot wait for 3 to 6 months, you can do the other tests which can pick up the virus directly. So once we diagnose the patient with HIV, then the next step would be to monitor the disease. I mean, how to stage the patient. So because HIV damages the immune system, so there are tests which can assess the immune function of the patient. So these tests are called CD4 count and viral load. CD4 count is nothing but it is a subset of T cell. So the normal CD4 count for a patient would range from 500 to 1500. That is a normal range. The other test that is available is the viral load. The viral load is nothing but it detects how many viral copies are present in the body. After diagnosing the patient with HIV, then the next step would be to start the treatment. So the treatment what we give for HIV, we call it as antiretroviral treatment or ART. This ART is most popular treatment available for treatment, and this ART there are different medicines available. The most important thing which determines is the CD4 count and the viral load. So before we start the antiretroviral treatment, we assess the patient. First, we counsel the patient whether the patient is prepared to start the treatment or not. Then we also rule out other opportunistic infections because patients who have HIV already have other opportunistic infections. So before you start the antiretroviral treatment, you need to assess whether the patient is having any opportunistic infection. You have to rule out those. Then you also have to assess the baseline function of the patient, like whether the patient is having any liver abnormalities or is the patient having normal liver function, kidney function, and you also have to do the complete blood picture. So if the patient is having all the parameters are normal and if the patient is not having any opportunistic infection, then we do the preparedness counseling for the patient. That is when we start the treatment. So before we start the treatment, we see the CD4 count. Now previously the guideline was used to depend on the CD4 count. They used to start treatment when the CD4 count is low, but now the guideline says that CD4 can be, the HIV treatment can be started irrespective of the CD4 count. So this is all about HIV treatment. In the subsequent video, I will be talking more about HIV treatment. And I would like to thank Lybrate, and if you want to consult me, you can consult me through Lybrate, or you can directly walk in, take an appointment and meet me at my clinic at Narayanguda.